Hi, my name is Dr. Jessica Marshall. I'm a licensed clinical psychologist in the state of Illinois, and I work at a behavioral health clinic that's also a training site. So I'm a training director for an accredited internship program. I am thrilled to be here today to be able to support you, whether it's you that's affected by Gorlin or a loved one, because I think it's so important to be able to pay attention to the emotional sides of how this affects people. So today I'm going to talk about managing stress and anxiety and a variety of the different approaches that you can take to doing that so that you can live a full flourishing life. I'm thrilled to see that there are some others on the lineup as well to be able to take on some other aspects of this. So I'm going to talk about just some of the general parts about how to pay attention to some of the terms that we usually confuse or mix around together, and some of the different various approaches that you can do to managing anxiety and stress well. So first of all, stress, I know we all are experiencing a lot of that right now, especially in 2020, but stress is actually a normal response of our body. It's a physiological response to pressure from a situation or an event, and that's actually impacted by our perception of the event too. So we might go through the same thing as somebody else, but how we perceive it can impact how much our body responds with stress. And stress can be helpful. It can help us rise to the challenge. I experienced some stress trying to get ready for this presentation, and it helps me meet those deadlines. But then sometimes stress can be really harmful too, especially if there aren't breaks from it and it continues over time. And so at times, stress can actually become anxiety, where there are just these really persistent and excessive worries or fears about different situations that don't go away, even when the actual feared situation isn't present. So you might see this if you're worrying about something coming in the future, even if it's not here yet. We have that tendency to kind of be on the alert, and sometimes that becomes overwhelming where we can't get rid of that thought, and it gets in the way of us being able to do the things that are really important to us too. And at times, when we have really life-threatening situations that we're experiencing or we witness for someone else, we can even develop a trauma response. And so that can be a physiological or emotional response to a perceived event that's deeply distressing or disturbing, where this becomes particularly relevant for people that are affected by Gorlins. There is a specific type of trauma that can be called medical trauma. And so medical traumatic stress refers to a set of psychological and physiological responses of patients and their families, because families are affected by this too as witnesses, to pain, injury, serious illnesses, medical procedures, and invasive or frightening treatment experiences. And so people with Gorlin syndrome are particularly vulnerable just due to the repeated surgeries and different invasive procedures that might be necessary to manage the BCCs and the tumors, especially because it's not always predictable, and it can be sudden and not as much time to prepare. And so one thing to be just keeping an eye out, because some people experience one event as traumatic and other people don't. And so three things that you can be looking for to see if this is developing into a trauma response is to look at, is there a re-experiencing of the traumatic event? So this might be if there was a particularly painful medical procedure, or a situation where somebody wasn't fully prepared for what was going to happen or was surprised by the response. There might be flashbacks or nightmares about that experience. This can be triggered by different reminders of that experience too. So a lot of people actually we carry a lot of memory for smell, which you might not always realize, but even just smell of like a disinfectant wipe or something that reminds you of a hospital can trigger a memory of being in surgery, or the color of clothing that you were wearing going in for that procedure. And so there are different things for our senses that can trigger this kind of automatic response, even if it's not the first thing on our minds at that moment too. Another thing to be keeping in mind too is we can develop avoidance responses too, and that's a way of our body trying to keep us safe, but it can become a problem when it's keeping us from doing things that are actually really important for our own health or for our relationships or for other goals that we have. And so you might see this with, if somebody is becoming very traumatized or fearful about different scans or protective parts, it might be an avoidance of, I'd rather not go into the doctor because I don't want to know if there's something else that needs to happen. But that avoidance response then can actually create danger or harm potentially for the person who's avoiding the information that they might need to know in the first place. The third aspect that you can be watching for is hyperarousal. So what this can look like is, we all have a kind of natural fight, flight, or freeze response when we're in danger. And you can see that really easily in like the deer stick in the headlights of that freeze response, or the running away quickly, or getting ready for something that might be coming at us. And what people who have experienced trauma can get kind of like stuck in that mode where there's just a prolonged experience of that as well. And obviously that has really harmful effects on our body if we're stuck in that mode too. And it can start to create where we're always scanning for the next danger that might come through. So with Gorlins, that might look like always being worried about the next basal cell carcinoma or the next tumor that might arise, even if there's nothing there at that moment, of just always being on that high alert. In some ways that's protective, but in some ways that might keep you from living a really full life or doing some of the things that are really important to you too. So finding a balance is what's really important to us as therapists that are coming alongside of you in the process. Some of the effects of just general anxiety too, where maybe it's not to the level of trauma, but just looking at general anxiety or thoughts about the self, about others in the world, and the future that are affected. So you might start to think, my future is always going to have this in it, and I'm not going to be able to do such and such, the thing that I'm looking forward to. Or it might impact how you see yourself of, I'm not going to be able to be as competent, or, and these are obviously very inaccurate thoughts, but sometimes anxiety can start to tell us these lies about ourselves or about other people in the world and our safety. It can also affect actions in general. So we talked about some of the trauma responses, but just actions in general, we might try to avoid things that cause the anxiety to grow stronger, and that actually sometimes can reinforce the anxiety too. So there's, if you're a parent, always that balance of, when my child is experiencing anxiety about something, do I keep pushing them into that feared situation, or do I pull back and save them and protect them from it? It's actually a balance, and it's really tricky to find that sometimes. But if we completely pull back and don't face those fears at all, it can actually make that fear even stronger by saying, yes, this is something to be feared, and it's a good thing that I stayed away from it. Versus if we can expose ourselves to it, but in a safe way where we feel like we have the resources and the coping strategies we need, that can start to tell us, oh, this isn't as bad as I thought, or this isn't as dangerous as I thought. There can also be these, physiological changes that can come alongside of anxiety too. So, we often feel this when we get tension headaches or stomach aches, or we can feel that we're clenching our jaws, or, there are a lot of different ways that we can realize that we're carrying stress or anxiety in our body. Kids, sometimes this is the primary way that that they express. They don't always have the words to say, this is what I'm afraid of, or I'm worrying about this thing. But they might tell you, hey, my stomach hurts, or I don't want to eat today, things like that. So paying attention to those physiological changes can be really helpful to get keyed in if the anxiety is becoming a problem for someone and not just a protective thing for them. I would love to talk with you a little bit more in depth if you're watching the recording. Obviously, we don't have that opportunity, but I'm going to jump ahead to talking about some of the different treatment options that are available too. So obviously, I do a lot of therapy, so the first one I put on here is, it can be helpful to get a professional involved to just, in the first place, do an assessment and just find out, is this just normal stress, or, kind of general, kind of typical anxiety. Anxiety is one of the most common mental concerns in children, and also adults, along with depression. And so a psychotherapist, that might be an LCPC or an MFT. There are lots of different people who have those credentials, and might be a clinical social worker or a psychologist. So they can all provide therapy. Usually that's covered by health insurance as well. And then there are a lot of different treatments that people can take in approaching both anxiety and trauma. Some of the ones that have just good backup in research that we've done are cognitive behavioral therapy, which looks at some of the connections between our feelings, our thoughts, and our behaviors. And there's also a children's version that's been adapted to language that makes sense to them, called Coping Cat, that can be really helpful. You can even actually buy those workbooks on your own if you're a parent and go through it, but it can be really helpful to have a therapist helping you pace it and problem solve with you along the way too. And then there's another type of treatment called acceptance and commitment therapy. There's also another called dialectical behavioral therapy that you'll hear about in the other seminar as well. And then as far as treatments that are focused specifically on trauma, there are a number of different options. One of them is called eye movement desensitization and reprocessing, EMDR is the shorthand I prefer. That helps with using some of the eye movements to help break some of the connections that we've made between the traumatic event and our body's physiological response. And it helps kind of be able to talk through the narrative of what's happened as well. There is another narrative model called the STARE NST that's great for adults, that's phase-based, of really building skills and then moving into kind of creating a meaning-making narrative of what you've experienced as well. Trauma-focused CBT is a type of CBT that's specifically focused on talking through the narrative of the traumatic event or events, especially if they're ongoing. And this is focused on children, adolescents, but the parents are heavily involved. And this can be a really great option for medical trauma as well. And then, of course, family therapy can really be helpful as well, because Gorlins doesn't just affect the person with the syndrome, but also all the family and the caregivers and siblings. And so having a place to be able to process that all together can be really helpful as well. Outside of psychotherapy, there are also a lot of other great options too for managing anxiety. So one of them, basic ones, is just maintaining physical health in a lot of ways. Sleep is really, really important, and helping either yourself or your child develop really consistent routines can be very helpful to making sure that your body has what it needs to be in a good place physiologically, as well as making sure that you're engaging in proper nutrition and feeding your body, fueling it well. And also physical activity can be really helpful too. Notice I didn't put just exercise. I think, going to the gym is great, but getting physical activity in throughout your day can be really helpful too. Even if it means, just making sure that every hour you're getting up from your chair and walking around your workplace. Mowing the lawn counts as physical activity, washing the dishes. So just finding different ways to be active throughout the day actually has a really strong effect on our emotional state as well, because our bodies are so tied into our minds. There is also the option of medication, and so this can be prescribed by a primary care physician, or if there are some complicating factors, a psychiatrist can be a great option too. And especially if the anxiety specifically about going into procedures or things like that, or doctor's appointments, there are more short-acting options that can be helpful too, that you can just take as needed. I don't always recommend medication being the first line of defense, because they can have some negative side effects that aren't always as helpful, but there are some really good ways that they can be used, and there are different classes of medications too that can be helpful to talk through with your doctor. One of the other options that can be helpful too, and this might, depending on your faith tradition, look different, but meditation or prayer or using mindfulness techniques. Probably the other person talking about radical acceptance may go into mindfulness a little bit more in depth, but these are all ways of just being able to kind of recenter yourself emotionally, spiritually, and physically too, to be able to kind of release some of the tension that's built up from the anxiety, and to become more focused on the things that are really core and important to you. There are some different free apps, or you can get the paid versions too if you want some more of the bells and whistles, but there are various apps that are available. One of them is called the Mindfulness app. There's another one called Headspace that you can get through the various app stores if you'd like to have some coaching to go through and get a guide. And some of these are appropriate to use with children as well. The mindfulness is more geared towards adults, but Headspace can be used with kids as well. And then there are tons of great self-help books and websites out there. I've listed a few of the different websites that I found particularly helpful as a therapist when I'm recommending these to families. The Anxiety Canada one is actually a whole program that you can go through either as an adult or as a parent for your child that guides you through treating different types of anxiety, and it can be customized to meet the different ways that that might be showing up for you. And there's also the Child Mind Institute that focuses more on children and families, and then the National Child Traumatic Stress Network is a great resource as well. I put the link down there that has specific information about medical trauma. And then having support groups is really critical too. I love what the GSA is doing and helping be able to connect people and families to others who are going through similar experiences, and having the mentoring options. I think having, knowing that other people are experiencing similar things, even if it might look different in their context, it can be so helpful to just normalize some of that, and then be able to talk with other people who get it and who have been through similar things is super important. You can also find a lot of great support groups through local hospitals. A lot of them have health psychologists that are specifically focused on the different ways that our physical difficulties can affect our mental health as well. And so they have some really great resources that are often available to free for the families. And if you're in the area, you can feel free to reach out to me, and I can help you try to find some local options too. But I would always suggest starting with your local hospital or the care team that you already have in place. And the last part, I just wanted to talk about the resilience option too. I know a lot of times psychologists talk about the problems and we focus on mitigating those factors. But I think it's also important to be preemptive too. And a lot of the ways that people can go through traumatic events but not develop trauma is when they have strong resilience. And so I've copied, and I can't take credit for this at all, but I've copied the 7 C's of resilience, of building blocks of resilience. And the website for that is below if you want to go in more in depth with some of this. But it just highlights some of the main things that can be really helpful with building resilience, especially for children as they're growing up. So one of these is competence. So really helping young people see that we notice when they're doing well and give them opportunities to develop skills that they feel competent in. When we do things too much for them, and I think that can sometimes as a parent be our tendency when we want to protect them, we don't give them the chance to kind of learn from their mistakes or recover from falls. And I know, with Gorlins, that can be kind of a scary balance to try to find, where you do need to help with a lot of different things, but also finding ways where they can take ownership in different ways too, and build skills in other areas that are outside of their identity as somebody with Gorlins can be helpful as well. Building confidence is really important too, of helping them feel like they know how to navigate the world, how to be able to recover from different challenges. And part of that means facing challenges and finding ways, whether it's through sports or chess tournaments or spelling bees or things like that. Just finding different ways where they can challenge themselves and build confidence is really important as well. The connection part can be really important too, and I know I talked about this a little bit with the support groups, but helping to be able to connect them with other people, schools, groups, community, really helps them develop relationships where they learn how to contribute and stand on their own, develop creative solutions. And character is important too. And I know if you're a parent, you're feeding into this as well, of helping develop a clear sense of right and wrong, and then commitment to integrity, of doing the hard thing, even doing the right thing, even if it's hard. 3 of the others are contribution, of finding ways that they have a way to give back. So that might be within the GSA, being a mentor or a big buddy to somebody else who's going through something too. But it gives a sense of having something to contribute and having value that they can add to others' lives, and being able to do that confidently. Coping strategies are really important too, because if you don't have strong coping strategies, you're going to tend to turn towards things that might be less helpful, like eating junk food, or worst case scenario, kind of like turning to drugs or things like that. But when we can build in really helpful strategies like mindfulness, or being able to identify negative thoughts and be able to shift them and things like that, that can be really helpful for resiliency as well. And then having a sense of control, of being able to have a sense that they can make wise choices and feel good about those choices. And I know sometimes it's hard with when you're parenting, of not wanting your children to make the wrong choices, especially if it might have really serious physical consequences for them too. So I think, it can be helpful to start small, of giving choices of two different things that are both okay and acceptable, and allowing them to have some of a voice in the process. And as your children grow older, being able to have them more involved in their care decisions for the level of information that's appropriate for them to know. And that's a great thing to be talking about with the care team as well, is, to what level can they be involved in this process where it won't be too overwhelming, but it will give them a sense of being heard. And so I hope that these tools are helpful to you. I'm looking forward to talking with you later on as time allows. But I really hope you also enjoy this new virtual conference format and are able to really benefit from all the different resources that are available to you this year.
One of the things I know, because you had limited time, you were giving us lots of resources for information. And so I want people to know that all of these presentations will be made available on our website in the next couple of weeks. So don't panic. You'll be able to see it and write these things down in your own time so that you'll have that information. And if you need it before it gets posted, you can email us at info@gorlandsyndrome.org, and we'll get the information to you immediately. So awesome information, Jessica. I really love the 7 C's. That's great. And one of the things that, before I get to the questions, I just want to say something from my own personal experience. A few years ago, I was facing surgery for an oral keratocyst, and I was telling a friend how I dreaded it, and she said, well, what you're talking about is PTSD. And I had told her about a previous experience with the surgery as a teenager, and that's when she said that. And I had never thought of it that way, but that made me realize, okay, I need to look into this to help me come up with some more coping tools to manage it myself. And so it's just a random thing, but I think it might be helpful for some people as well. So our first question, why don't we bring that up now? What's the best way to help young families who find out that their child or they themselves has Gorlin syndrome? How do we best help families who are new to the group and the syndrome, given how vastly different each case can be and the severity?
Yeah, I love that that GSA is giving a place for families to be able to connect with one another, and how you're creating resources to really educate families as well. I think that having information, and even though it might range quite a bit, is important for helping create a frame of reference for families to know what things to be considering and on the lookout for, as well as being able to foster support for them. While still managing to not say like it's going to look exactly like this, because it won't. There are going to be individual differences for everyone, but the education part and then the sense of community and support, I think, is so important, as well as being able to help normalize some of the different emotions and experiences that they're going through, helping them recognize that they're not alone in the grief that might come with that, or the fear, or numbness, or just feeling overwhelmed by all the choices and decisions that they have to make, and things like that. So being able to just create a space to be a sounding board, I think would be so valuable to new families trying to figure this out and navigate it, finding a balance between advice and just listening and being a supportive ear.
Great, thank you. And the next question, how do we help ourselves and our children deal with the anxieties such as fear or not waking up from anesthesia? I'm going to jump in here with a little tip and trick that I use and used for my kids and others that I've talked to. Anxiety about anesthesia. I would always, and I used to be a physician assistant, so I'd tell people, I want you to be focusing on, think about a beautiful picture, a beautiful place where you like to go, and focus on that when you start to feel overwhelmed by what might be happening. But what other tips and tricks do you have?
Yeah, and I have to say, I'm speaking in generalities. I can't speak to anyone's particular situation just because of this format. But I think one thing is to recognize, like, some of these fears that come up are legitimate, and they come from a place of recognizing there are some real risks. So acknowledging those, I think, is a place to start. But at the same time, you don't want to get stuck there where you're ruminating on that, and it causes you to either avoid things that actually need to happen, or to be stuck in a place of really anxiety for the period of time leading up to the procedure. So, part of it is a cognitive strategy of recognizing, this is the choice that I have to make to take care of my body and to be able to continue to move forward in treatment. And then recognizing what is realistic, what's not, what are the chances that something bad will happen. Well, usually fairly small, even if it's still there. And then staying as present to the current moment as possible in some ways might be helpful, of not going too much into the future of the what ifs of what if this happens or what if that, but just kind of staying in the, like, right now I'm just sitting in my car and I'm safe in my car right now, or right now I'm sitting in the chair and I'm waiting, but I'm safe right now. Rather than going into the fearful part. And then what Julie was mentioning is so helpful too, of some distraction techniques too, of what can I do to, instead of ruminating on the worst case scenario, how can I distract myself with something that's more positive or calming or soothing for me? And with kids, sometimes that might be different breathing exercises, of just focusing them on the experience of, like, breathing in and then breathing back out again, and letting that go slowly. And that can help actually within the physiological part of managing the anxiety around that. Because our bodies, like I had mentioned earlier, can get into that fight, flight, or freeze mode, especially if there's a specific fear, like around the anesthesia. And so being able to regulate that by what we call belly breathing or diaphragmatic breathing, of really, like, filling our whole belly with air and letting our body be able to exchange and take in as much oxygen, that can start to trick our body, instead of going into the fear fight mode, of being in the relaxed, safe, present mode. And that can be helpful too. The different families might use, reading a book or playing a video game or things like that. Not, you don't want to get into where you have to distract all the time, because there's school and work and other things too. But if you're sitting in a waiting room and, it's hard to ignore, it might be helpful to have something to shift your attention onto instead.
I agree. Yes, those are all great tips. And another mechanism might be to call the anesthesia department at the hospital where the surgery is going to occur, to let them know that you or your child are having these concerns, and do they have any guidance for you, or websites or information you can use to help yourself or your child, and let your physician know, the person doing the surgery, so that they can provide or potentially provide similar assistance. So, all right, we
Some
have
of
two more
the
questions. Oh, go ahead, Jessica.
One of the things I forgot to mention is some of the hospitals do have like therapeutic play, where they can help you kind of role play some of the different procedures and things like that on a level that your child might be able to understand and help prepare them for. So the different hospital staff that specialize in dealing with health psychology and things like that can be a fantastic resource and really understand the developmental stages of where your child might be at as well.
Great point. Yes. Okay, we have two more questions. So why don't we take the next one? What's the best way to teach your children about their diagnosis, and how can we help them cope? Some of this you've already covered, and we have to all remember that these questions were submitted ahead of time. But this is really still important information to offer our kids. And obviously, I think it depends on the age of the child, but I'll let you take it from here.
Yeah, I think the age is critical. Kids can handle different amounts of information at different times. And the words that we use, we have to be really careful to make sure that we're communicating in a way that is going to make sense to the child, and not understand that sometimes they might take one thing and kind of blow it up into what we didn't mean it for. So the hospitals and the mental health departments or the psychology services of the care teams that you have access to have fantastic developmental psychologist teams in place that are used to helping talk through this with you. So really take advantage of that. And then using, there are different books that can be helpful too, of talking through in a story format what procedures might look like or what a diagnosis might mean. I don't know if we can challenge somebody to create one for Gorlin syndrome. That would be really helpful, I think, to different families if you don't have somebody on that yet. But that narrative approach can be really helpful for children as well. And I love how you have the opportunity to be able to connect people up with other families too, where they can maybe hear from a peer that's been going through a similar thing too, and hear it on a peer-to-peer level as well.
Thank you. Yes, that's nice. All righty. So our last question. The ongoing procedures between skin tag removal and cysts are not subsiding as we hope for a 23-year-old. Please share advice for long hauler parents on how to assist our adult children with ongoing care. How do we share hope that there may become a time in his life where he won't have to do so many surgeries?
And that hope piece in that question is so important because we do know from the research that the more hopeful you are, the more positive outcomes are associated with treatment of the disease. So hope across the board is really important to maintain. I know that can be hard and discouraging though when there have been years of struggling and different things that you've had to push through. I think one of the things is trying to find a way to flourish in the moment too. I know there's the long-term view of hoping like things will get better when I get past this or get to this point. But finding ways to still flourish in the moment is really important. What does a meaningful life look like, even with the different aspects of Gorlin that are getting in the way of some things? Are there ways that you can still feel like you have a way to get back or pursue dreams or things like that? I think are important for finding hope even in the present moment. That can also then lead to the long-term part. And then I'd say too, if there are, even if you're in it for the long haul, are there people further along that can speak from a place of their own personal experience? I know it won't be the same for everyone, but who can say, hey, it was really hard for a while, but I did get to this place. Hearing that from real life people, I think could be really encouraging for having something to kind of keep moving towards and hang your hope on as well.
I agree, totally. Thank you so much. I really appreciate this and the time you've taken to put the presentation together and talk to us today. Thank you so much, Jessica.
Yeah, thank you for letting me join you all with this. It's really been a privilege to learn more about Gorlin from the families that I worked with and get to know this community.
We appreciate it as well. I know they do. Thank you, Jessica.